So about 9 months ago, my son got mono, average college illness. I had it. I was out for 2 months and then back on my bike and doing what I normally did. With my son Aiden, it didn't work out that way. He ended up having some muscle weakness. So to give you an example of the degree of muscle weakness, prior he was squatting his body weight almost, and after he can't do 3 air squats. So for those of you that don't know an air squat, it's simply when you crouch and then go back up, like getting out of a chair. So there is a series of neurology consults that he underwent. They look for the obvious. They do muscle testing. He had some muscle weakness, and that was in his quads slightly. Extension was slightly decreased on one side. He had EMG NCV study. For those of you that don't know what that is, they measure tracings of the muscle output. They can map that, and he had a slight sural weakness on the left nerve. Now, the issue is that it's still nebulous what his diagnosis is. So he then went to get an MRI. That showed something equivocal, meaning not sure if it was something or just an artifact. They thought something on a cervical segment. He had brain, cervical, thoracic, and lumbar, all segments. Maybe a shadow on the cervical. So then what was done is they repeated the MRI, they got more blood work, and they repeated the MRI with a higher Tesla unit, and that's where I am today. And so I'm waiting for Aiden to get out of the unit where he is going to have just the cervical and the thoracic. Those are the 2 regions closest to where they thought they might have seen something. Now, he also had something in this last battery of tests that the insurance kicked out on the first round, called myomarkers. And the myomarkers are designed to show some trace proteins that might be able to hang our hat on a diagnosis. And one of those came up mildly positive, so it'll be determined what the neurology consultation with the neuroimmunologist will determine as to next steps. It may very well be that the decision is that may not be enough to hang a diagnosis, so he may go on to have a lumbar puncture. So obviously a lot of steps, a lot of unknowns, and I think the trouble with a lot of these unexplained post-viral syndromes is that oftentimes you're not going to have a solid diagnostic test to show that, yep, that's what you got, this is what we're going to do. And the challenge is that the insurance companies want that. They want to have something very determinate. So then it's up to having your doctor as an advocate battle for that to try to get potentially advanced therapies, which may or may not help in this situation. And then there's the array of other immune support things, taking high doses of vitamin D, taking zinc, the no-brainers like getting better sleep, lowering your stress load, which is probably the elephant in the room, is that stress is certainly going to be high with a second-year engineering program at Virginia Tech for him right now. So I'll provide an update as we go down the road with this. I think it's important, having talked to different people with Epstein-Barr virus and other things, post-COVID syndrome, et cetera, that you get a support group, other parents, other kids that have had it, and other people that your loved ones can connect with, particularly those that are in the midst of trying to figure out what it is that it is. So for everybody out there, keep looking to the light. That's the best way. keep trying to educate yourself, and hopefully in time, there's some moonshots of research that have been underway, and hopefully funding will continue with those, and we'll have some answers.